Dr. Henry, can you talk about the areas of the province that have seen the lowest vaccination rates and, the reasons why, and whether that's one reason for your traveling around the province?
Sure, and I'll talk, and I know the minister has some interest in that as well. There are a number of different areas, and what we have seen is that when we pay attention to different areas and when we use different strategies, they work. And we're not seeing widespread anti-vaccine sentiment. What we are seeing are some areas where people have questions, some areas where there may not be as equal access. And that's why we put out the word today about people who have ideas here in the north for their community where we could go and set up a clinic. And those have worked really well. Some of the drive-through clinics in some of the areas. And we know in the northeast, there's a number of smaller communities spread out in rural areas where it's more challenging for people to get into an immunization clinic. And we've had challenges with teams and staffing and being able to get everywhere in the north. So these are one of the reasons I'm here. But the other reasons I'm here, of course, is that it's been a long time and I haven't had the opportunity to meet with our teams and to really just appreciate all that they've been doing across the north and the interior, and just grateful for that opportunity. So it varies by different communities, and I know on the ground here they're looking at that very carefully. What is it about each individual community, and what are the things that we need to do in each individual community? But the other thing I think that's really, really important, and I appeal to my colleagues in primary care across the province, having those conversations with your patients, with your family, with your communities. It is important that we all give people the information they need, and hearing it from a trusted provider is important too. And Minister, did you want to address that?
To thank many of the communities. We saw in Grand Forks this weekend. We see in 100 Mile House today. We see in Richmond, which we were getting questions on, and we're looking at as we provide this information. The provincial average in terms of over 12 first dose immunization, which is a real achievement of community. So our approach from the beginning has been to work with communities and work with people, not to draw conclusions, but to see slightly lower vaccination rates in one community as a challenge for all of us to raise those levels up. Because when we immunize people, whether it's drive-through clinics in Fort St. John or in a park in Grand Forks or a 24-hour or 36-hour vaxathon in Surrey, we find different ways to reach people and to raise those levels of immunization. I'm very proud, for example, as of today, I think in the Surrey local health area over 12, we're going to have over 80% immunization, and that's an achievement not just of public health and of public health workers, but of the whole community there, of unions and business groups, of Gurdwara and mosque and church organizations, of everyone. And we have to continue to do the same effort. Everyone is everywhere. So it's not to point out those who are falling behind, but to help us raise those levels everywhere. And the community that was behind a few weeks ago, we hope will be ahead in the coming weeks, and that will require more hard work.
Lisa, do you have a follow-up?
Yes, thank you. When do you expect or hope to have 75% of British Columbia's population fully vaccinated with 2 doses? And would it be reasonable to expect that could happen by July the 31st?
The short answer is yes. Obviously, we want to do that as fast as we can, but we also want to make sure that we keep that a good interval between dose 1 and dose 2. So there may be some spillover in people who are just getting immunized now into early August, but I think we can get up there. And we're looking at certainly middle of July to try and get to 80% across the board. And then looking at how do we get second doses into people as quickly as possible as well.
Good afternoon. Thanks for taking my call. My question was, I guess, for either one, the doctor or the minister, but as the provincial approach approaches that 70-75%, there's some other areas that are less, more at about, say, 45-50%. And my question is there any consideration or a plan of attack as far as beyond what's been discussed today, beyond different restrictions or different limitations for the pockets, as you say, of the area of the province that are still at around that 50%?
I think we tend to take the carrot versus stick approach, and that has worked very well for us here in British Columbia. So it really is about encouragement, about answering people's questions, making sure they have confidence in the vaccines that we have. And what we see over and over again is access, taking away those barriers for access to vaccines, making it convenient for people, and that it goes a long way in many, many communities. So we are going to continue that. We're going to be encouraging people, and I think this is where community leaders, and I know the minister can talk to this, where your sports teams and all of these activities that we can get back to, because immunization has changed the game for us. It will no longer be a pandemic. It's part of us being able to live with this virus and not have it affect our lives the way it has so much. So things like being able to travel, to come to visit my teams here in Prince George, or our teams here in Prince George, to be able to visit family that we haven't seen. To do that safely, we need to protect each other, protect ourselves, and protect them, and that means being immunized.
In your territory, we're now over 50% in Dawson Creek. We were below that before. We're above 50% in Fort St. John, about 54%, I think, in Fort St. John. A community such as Tumbler Ridge, which was down around 51%, is now at 60%. So I think we're making some progress. And we've seen this in some communities around BC, as I said, which were lower and have now seeing significant increases. So what you're going to see is the strategy we've used up to now, which is giving people the information about some of the best vaccines the world has ever seen, to talk about their effectiveness. A community like Prince Rupert has differences than a community like Fort St. John on the other side of the Great Northern Health Authority. But what happened in Prince Rupert was we went from a lot of cases to almost none because people got vaccinated. And people who live in the Northeast, we've seen this in terms of transmission. We see it now in our current maps, are just as vulnerable right next door to Alberta as anywhere else. And so we need people in that region to get vaccinated. We just got to keep working on it together. And I know that Mayor Bumstead in Dawson Creek is supportive of that effort. The local MLAs, Dan Davies and Mike Bernier, have joined in that effort. Mayor Ackerman in Fort St. John and all the other people in those municipalities. We just got to keep working through, not pointing and saying what's wrong, but working to raise those levels of vaccination, which are going to keep everyone safer and allow everyone to get back to all the things they love to do in that great part of the world and great part of our province in this summer and beyond.
Rob, do you have a follow-up?
Certainly, just these pop-ups that you've brought up and broached today, is that something that either the Minister or Dr. Henry C. Could see working and potentially upping that percentage up here in the north in general?
Absolutely. This was a discussion I had with colleagues in Northern Health earlier today, and they were saying, people had some really good ideas about where a pop-up clinic would work in their community. So I encourage you all, if you have an idea, I know going to the Saturday farmers market was and having a pop-up clinic there, making it easy for people to go and get your fresh fruit and vegetables from your local farm and get your vaccine at the same time. So it is ideas like that about things that can happen in your community, as we move into being able to come together more often, are these opportunities where we can also come together as a community and be protected. So Northern Health is looking at ways that they can support that. So if you have ideas, as I said, it's COVID-19 at northernhealth.ca, and they're willing to work with you to see whether we can put a pop-up clinic in your community.